It is a condition millions of people deal with every year. Scoliosis. The condition causes the spine to curve. It can lead to other health problems. This month is Scoliosis Awareness Month, and doctors and health advocates want to educate people about this condition. Joining us this morning is Dr. David Feldman. And Dr. Feldman, thank you so much for being with us. Let's first talk about the symptoms of scoliosis. What can you tell us?
So many times scoliosis has no symptoms. It just sort of presents as a bump on the back, or it's a little bit of irregularity. The child or adolescent looks like they're off balance. It may cause some pain, but not severe pain in usual cases. And so oftentimes it requires an examination, either from the pediatrician or from an orthopedic surgeon, someone who's aware of what scoliosis looks like.
And you said, the pediatrician, oftentimes I know when I take my kids to go to the pediatrician, particularly my young daughter, it's always you bend over and I can see that they're looking at her spinal, her spinal cord and the bones there. What is it the adolescents who are most at risk? Is that who we're talking about here?
Right, exactly. Now, interestingly, boys and girls or men and women are equally susceptible to scoliosis. However, girls and women get it much more severely than men. So oftentimes it's the adolescent girl, the prepubescent girl, or the girl who's right now reaching puberty, where all of a sudden then you notice the scoliosis, you notice the imbalance or the bump on the back or the prominence on the back that the pediatrician or the mother or friends or even the child may notice.
So you want to make sure if you've got a tween at home and she's a girl, you want to make sure that you are getting that yearly checkup with your pediatrician, right?
Exactly, even more than a yearly, because oftentimes when either a girl or a boy reaches puberty, we never see them undressed anymore. We never see them with their shirt off. So sometimes it requires you go to the beach and all of a sudden you look at the back and say, oh wow, when did that happen? So it is really nice to diagnose it early, because I think we'll talk about what we can do about scoliosis now.
Yeah, let's talk about that. Are there preventative steps? I never knew that you could really prevent it. I thought it just happened.
And that's exactly true. And I've been doing this for 20 years. And it used to be we told people that you couldn't do anything about scoliosis. There's nothing that could be done. But now, with certain types of physical therapy, we've really shifted towards doing something about scoliosis. And that's called the Schroth or the Schroth method. And there's some bracing involved sometimes, not all the time. But that type of physical therapy, which is not intuitive and not easy to learn, is really the keystone now to treating early scoliosis, where scoliosis is treated in a very mild stage.
So is that something locally that's going on here that people, if they are interested or they want to learn more about it, that they can do?
Absolutely. We at the Paley Institute, we have now 4 physical therapists who are trained in this method, and it takes about 20 visits or somewhere in that range for the child or the adolescent to learn how to do these special exercises. And then they can do them at home. And there's no question that there's now research involved that are showing that this actually can prevent the progression of scoliosis in a good percentage of the kids and adolescents who have this disease.
Very interesting. Never knew that was going on, and good to know that we're taking those steps to being able to prevent it as opposed to just treating it later when it happens.
Exactly. I used to tell people there's nothing we can do. Go home. It's only mild, and we'll just see what it turns out. That is not true anymore.
All right, Dr. Feldman, thank you for being with us this morning.
Thank you.